Think memory tests are just for people already showing symptoms? Think again. There's a simple test that takes less than 3 minutes that doctors around the world are using to catch the earliest signs of cognitive changes, often years before families or even patients notice problems. This isn't some complicated medical procedure. You don't need expensive equipment or a specialist's office. The Mini-Cog test, developed by leading neurologists, combines two simple tasks that can reveal whether your brain is functioning normally or showing the subtle changes that might indicate mild cognitive impairment, the stage that often comes before dementia. The test is so effective that it's now recommended by the Alzheimer's Association and used in primary care offices across the country. Research shows it has a 76% accuracy rate in detecting cognitive impairment and an 89 to 93% accuracy rate in correctly identifying people who don't have cognitive problems. But here's what most people don't know. Catching these changes early can give you years to take action. In this video, we're revealing exactly how this test works, what it measures, and how you can take it at home. We'll show you what normal results look like, what concerning results mean, and most importantly, what steps you can take if the test suggests further evaluation is needed. Stick around until the end because we'll give you access to the actual test and explain exactly how to interpret your results. But before we dive in, let us know in the comments, have you ever worried about your memory or thinking abilities? We're reading and replying to every single comment. Now let's explore this simple but powerful tool that could change how we approach brain health. What is the Mini-Cog test? The Mini-Cog is a rapid cognitive screening tool that combines two simple tasks to assess your brain's function. Developed by Dr. Suborsan and colleagues, it's designed to be quick, effective, and culturally fair, meaning it works equally well regardless of your educational background or primary language. The test evaluates two critical brain functions that are among the first to decline when cognitive problems develop. The first is short-term memory, your ability to remember new information for a brief period. The second is executive function, your brain's ability to plan, organize, and complete complex tasks. What makes the Mini-Cog special is its simplicity. Unlike longer cognitive tests that can take 30 minutes or more, the Mini-Cog takes just 3 minutes. Yet studies show it's remarkably effective at identifying people who need further cognitive evaluation. The test consists of two parts, a 3-word recall task and something called the clock drawing test. Both are designed to challenge your brain in ways that reveal subtle changes in thinking and memory. Let's break down exactly how each part works. Part 1. The 3-word recall test. The first part of the Mini-Cog tests your short-term memory using 3 simple, unrelated words. The test administrator will say 3 words clearly and ask you to repeat them back immediately. This ensures you heard them correctly. Common examples include words like banana, sunrise, chair, or daughter, heaven, mountain. The words are chosen to be completely unrelated to each other, making them harder to remember using logic or association. After you repeat the words back, you'll be asked to remember them while completing the second part of the test. This creates what researchers call a cognitive load. Your brain has to hold on to the words while focusing on another task. This is much more challenging than simply remembering 3 words with no distractions. Short-term memory problems are often one of the first signs of cognitive decline. In early-stage dementia, particularly Alzheimer's disease, the brain regions responsible for forming new memories are among the first to be affected. People might remember events from years ago clearly, but struggle to recall what they had for breakfast or where they put their keys. The 3-word recall specifically tests your brain's ability to encode new information, hold it briefly, and then retrieve it on demand. It's a fundamental cognitive process that we use constantly in daily life. From remembering a phone number long enough to dial it to recalling instructions someone just gave you. After completing the clock drawing task, you'll be asked to recall those 3 words. This is where the test reveals its power. People with normal cognitive function typically remember all 3 words, or perhaps miss just one. Those with mild cognitive impairment might remember only one or two words, while people with more significant cognitive problems often can't recall any of the words. Part 2, the clock drawing test. The second part of the Mini-Cog is the clock drawing test, and it's remarkably revealing about your brain's executive function. You'll be given a piece of paper with a pre-drawn circle and asked to draw a clock face showing the time 10 minutes past 11 or 11:10. This might sound simple, but drawing a clock correctly requires multiple cognitive skills working together. First, you need verbal understanding, translating the spoken instruction into action. Then, you need visual memory, remembering what a clock looks like. You also need planning skills, understanding that you need to put numbers in the right places before drawing the hands. The task also requires abstract thinking. When someone says 10 minutes past 11, your brain has to understand that the minute hand points to the 2, representing 10 minutes, while the hour hand points to the 11 hand points between the 11 and 12. This level of abstract reasoning is one of the higher-order brain functions that can decline early in cognitive impairment. Research has shown that specific types of errors on the clock drawing test can indicate different types of brain changes. For example, people with Alzheimer's disease often make what researchers call stimulus-bound errors. They might put both hands pointing to 10 and 11 instead of understanding the abstract relationship between time and clock position. People with vascular cognitive impairment might have different types of errors, often related to spatial planning or the physical act of drawing. Those with frontotemporal dementia might struggle with the concept of time itself, perhaps drawing numbers in random positions. A normal clock drawing includes all numbers 1 through 12 in approximately the right positions around the circle, with the hands pointing to the correct times. The hour hand should be shorter and point between 11 and 12, while the minute hand should be longer and point to the 2. How the test is scored. The Mini-Cog uses a simple but effective scoring system. For the 3-word recall, you get 1 point for each word you remember correctly, for a maximum of 3 points. For the clock drawing, you get either 0 points for an abnormal clock or 2 points for a normal clock. Here's how the final interpretation works. If you recall all 3 words, regardless of your clock drawing, the test suggests normal cognitive function. If you recall 0 words, regardless of your clock drawing, the test suggests possible cognitive impairment that warrants further evaluation. The middle ground, recalling 1 or 2 words, is where the clock drawing becomes crucial. If you recall 1 or 2 words and draw a normal clock, the test suggests normal cognitive function. But if you recall 1 or 2 words and draw an abnormal clock, the test suggests possible cognitive impairment. A total score of 0, 1, or 2 points indicates a higher likelihood of clinically important cognitive impairment and suggests you should see a qualified healthcare professional for further evaluation. A total score of 3, 4, or 5 points indicates a lower likelihood of dementia, but doesn't rule out some degree of cognitive impairment. It's crucial to understand that the Mini-Cog is a screening tool, not a diagnostic test. A concerning result doesn't mean you have dementia. It means you should have a more comprehensive evaluation by a healthcare professional. Many conditions can affect cognitive function, including depression, anxiety, medication side effects, sleep problems, or medical conditions like thyroid disorders. What the research shows. The Mini-Cog has been extensively studied and validated across different populations. Research published in multiple medical journals shows that it has a sensitivity of 76 to 99%, meaning it correctly identifies people with cognitive impairment between 76% and 99% of the time, depending on the study. The test also has a specificity of 89 to 93%, meaning it correctly identifies people who don't have cognitive impairment about 9 times out of 10. This combination of sensitivity and specificity makes it a valuable screening tool. A recent study found that the Mini-Cog was particularly effective at detecting mild cognitive impairment, the stage between normal aging and dementia. Researchers followed 665 patients over 8 years and found that those who scored poorly on the Mini-Cog were significantly more likely to develop dementia over time. What's particularly impressive is that the Mini-Cog often detects cognitive changes before patients or families notice problems. The test can identify subtle changes in thinking and memory that might not be apparent in daily life, but indicate the brain is beginning to struggle with certain tasks. The test has been validated across different cultural and educational backgrounds. Unlike some cognitive tests that can be biased toward people with higher education or specific cultural knowledge, the Mini-Cog works equally well across diverse populations. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. The value of early detection. Detecting cognitive changes early, even before they significantly impact daily life, can be incredibly valuable. While we don't yet have cures for dementia, early detection allows for important interventions that can slow decline and improve quality of life. Research shows that people who know about their cognitive changes early can take steps to optimize their brain health. This includes managing cardiovascular risk factors like high blood pressure and diabetes, staying physically and mentally active, maintaining social connections, and addressing modifiable risk factors. Early detection also allows for better planning. People can make important decisions about their future care, finances, and legal matters while they still have full decision-making capacity. They can also participate in clinical trials for new treatments, which often require participants to be in the early stages of cognitive decline. From a family perspective, early detection helps everyone understand what's happening and plan accordingly. It can reduce the confusion and frustration that often accompany unexplained memory or thinking problems. Taking the test at home. While the Mini-Cog is designed to be administered by healthcare professionals, understanding how it works can help you monitor your own cognitive health or that of a loved one. However, it's important to note that self-administration isn't as reliable as professional administration. If you want to try the test, you'll need someone to help you. The words need to be spoken aloud, and you need someone to time the test and evaluate your clock drawing. You'll also need a piece of paper with a pre-drawn circle about 4 inches in diameter. The person helping you should choose 3 unrelated words and speak them clearly. After you repeat them back, they should ask you to draw the clock showing 10 past 11. After you complete the drawing, they should ask you to recall the 3 words. Remember, if the results suggest cognitive impairment, this doesn't mean you have dementia. Many factors can affect cognitive performance, including stress, fatigue, medications, depression, or medical conditions. The important thing is to follow up with a healthcare professional for proper evaluation. When to seek professional help. You should consider professional cognitive evaluation if you consistently perform poorly on tests like the Mini-Cog, or if you or others notice changes in your memory, thinking, or daily functioning. Warning signs include frequently forgetting recent conversations, getting lost in familiar places, having trouble managing finances or medications, or difficulty completing complex tasks you used to do easily. It's also worth seeking evaluation if you have risk factors for cognitive decline, such as a family history of dementia, cardiovascular disease, diabetes, or depression. Many of these risk factors are modifiable, and early intervention can make a significant difference. Don't wait until problems become severe. The earlier cognitive issues are detected and addressed, the better the outcomes tend to be. Modern medicine offers many strategies for supporting brain health and slowing cognitive decline, but they're most effective when started early. While the Mini-Cog is an excellent screening tool, it's just one part of a comprehensive approach to brain health. If screening suggests problems, your doctor might recommend more detailed cognitive testing, brain imaging, blood tests to rule out other causes, or referral to a specialist. The good news is that many causes of cognitive problems are treatable. Depression, anxiety, sleep disorders, medication side effects, vitamin deficiencies, and thyroid problems can all cause memory and thinking problems that improve with proper treatment. Even if testing reveals early dementia, there are more treatment options available now than ever before. New medications can slow progression in some people, and lifestyle interventions, including exercise, diet, social engagement, and cognitive training, can help maintain function longer. The Mini-Cog represents a powerful tool in our growing arsenal for protecting brain health. In just 3 minutes, this simple test can provide valuable insights into cognitive function and alert us to changes that warrant further attention. Remember, the goal isn't to diagnose yourself or create anxiety about normal memory lapses that happen to everyone. The goal is to be proactive about brain health, just as we are about heart health or any other aspect of our well-being. If you're concerned about your memory or thinking abilities, don't suffer in silence or assume it's just normal aging. Many cognitive problems have solutions, and even those that don't can be managed much more effectively when caught early. Have you ever taken a cognitive screening test? What was your experience like? Share your thoughts in the comments below. We're reading and replying to every single one. And if you want more senior-focused health information that's based on real science and could genuinely help protect your cognitive health, make sure to subscribe and turn on notifications. Your brain health is too important to leave to chance, and knowledge is the first step toward taking control. Remember, seeking help for cognitive concerns isn't a sign of weakness. It's a sign of wisdom. The sooner we address problems, the more options we have for maintaining the brain function that keeps us independent and engaged with life. Comment Mini-Cog, and we will send you the test. Thanks for watching, and here's to keeping our minds sharp for years to come.